Welcome to San Francisco, California. San Francisco, the city by the bay.
Can't believe your heart.
In San Francisco.
San Francisco is an amazing city.
There's really something there for everyone.
If I had to pick one thing,
Chinatown.
Fantastic weather.
I go out to Alcatraz.
A lively atmosphere in the streets.
Fisherman's Wharf,
Coit Tower,
the Golden Gate Bridge,
the hills and Lombard Street, the Moscone Center, and TCT. We should have an evening symposium in Alcatraz.
We actually looked at every city in the U.S.
The Asia-Pacific Rim has become extremely important in global interventional cardiology.
We'll be closer to our Asia-Pacific colleagues.
It was time for a change.
San Francisco captures the spirit of TCT.
San Francisco has this aura.
It's an eclectic city, it's an avant-garde city, it's a little bit of a renegade, on-the-edge city, and those are many of the characteristics that we try to impute into the TCT conference. So innovation in TCT and the radicalism of San Francisco will match beautifully.
Well, it's about time, don't you think?
We made a conscious effort to transform TCT this year, our first attempt to go to a new city. Innovation.
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 Focus on therapy innovation.
Evidence.
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 Trust in evidence-based medicine.
And most important, patience.
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 Dedication to putting patients first.
This year, we want to focus more on patient care.
So if we think about putting the patient first and work backward,
What's best for our patients?
we have to learn how to evaluate them. We have to understand the range of therapies
Or returning to the basics.
where everything we do puts the patient first.
And clinical care is the most important aspect.
That's what TCT is about. Interventional cardiology and vascular medicine has spread beyond just the treatment of coronary artery disease.
It's evolved, it's grown.
And this is a subspecialty that is moving extraordinarily rapidly.
We're going to stress innovation, the cutting edge of interventional cardiology.
Percutaneous valve therapy is the new frontier for interventional cardiology.
Structural heart disease is going to get much more emphasis.
This field has absolutely taken off.
A landmark therapy.
The buzz about valve therapy for patients with aortic stenosis and mitral regurgitation has really been transmitted worldwide.
Will totally change the way we approach these patients.
That's going to be one of the major themes this year.
We'll be talking a lot about bioabsorbable polymers, bioabsorbable stents.
Some hybrid technologies.
We are much more disease specific. TCT is all about evidence-based medicine.
This year we decided to emphasize the abstract presentations.
A dedicated 4-hour block
In an effort to try to promote investigation amongst our junior colleagues.
Because that's how medicine advances.
I don't think there's one thing I'm excited about, there's 100 things.
And there will be several new features at the conference.
2 new theaters. One theater is actually called the Evidence-Based Medicine Theater.
The goal is to provide more clinical information.
Whenever possible, we should take the unknown out of the treatment of patients. We have another new theater called the Challenging Case Theater.
I'm most intrigued about the how-to sessions.
Interventional cardiology, of course, is a very hands-on subspecialty, and it's one thing to know how and when to treat a patient, it's another thing to be able to do it.
The aspects of interventional cardiology that our colleagues use in their day in and day out practice.
There's always going to be some questions to be answered.
TCT has really become a world meeting. This year we expect for the first time to have more physicians from outside the United States,
Many more international faculty.
more than 90 countries represented. It's our responsibility to do whatever we can to make TCT as accessible to the entire world as possible.
I would personally like to welcome all of my colleagues.
And I hope that the people who will come will truly enjoy the meeting.
It's about you and it's about your patients.
For those of you who are new to TCT, we hope that this will be the first of many experiences.
So thank you for coming to San Francisco this year.
We're all extremely excited.
It's really going to be a celebration of interventional cardiology.
New ways to treat your patients that will make a difference tomorrow. It's all about innovation, evidence, and patience.
Welcome.
Welcome.
Welcome to TCT 2009.
San Francisco.
It's going to be great in San Francisco.
We are so thrilled to have you with us.